Good evening, everybody. Back on our Facebook Lives on Tuesdays evenings. For those of you who don't know who I am, I'm Dr. Verdiales. I am the Atlanta doctor, more like Monroe, Georgia, which is 45 minutes east of Atlanta. Like every Facebook, I like to discuss a subject and then go into your questions. Again, for those of you that have not seen my lives before, I am Dr. Verdiales, and I am the Atlanta doctor. So it's CNY Atlanta, and the number I always like to share it with you is 315-469-8700, extension 2274 and 2283. Hello everybody that's joining us. Thank you for joining us and sharing this half an hour with us. So the subject of today is the importance of honoring your body, which is your temple. And why have I chosen that? Because I see it in so many ways through the days, through the weeks with you and my patients. And today something miraculously happened, and I see it over and over again when we take that time to honor ourselves, to take care of this vessel that will be carrying life. It's very important for everybody to understand that reproduction and sex are visualized by nature as luxuries. So if there is something in your body that's triggering the subconscious in believing that you're surviving, reproduction will be shut down. Like if you're barely able to keep yourself alive, much less will you be able to support two living beings. So miracles happen every day when we step back and do what we need to do in order to have a healthier lifestyle. So today, like I was saying, a great miracle happened, or another, should I say, miracle happened with one of our patients. I know that she's out there pinching herself. She has been with the Atlanta team for about 8 months, I would say. I think she came to us like November or December of 2019 after having 2 failed IVF at a local clinic due to extremely low ovarian reserve. One of the IVF cycles was even using very high doses, 450 of Gonolef and 150 of Menopur, which produced 2 eggs and 0 embryos. So, you know, she came to us almost like a last resource, because all of you know how expensive IVF is in other clinics. So after spending quite a bit of money in IVF, and to have nothing to show, she came to us, and we started digging and seeing what else could we do to help her and improve that ovarian reserve. She is 38 years old. Luckily, she has 1 child that required some assistance, but not as much as this round has been for her. So on this time, for those of you who have heard me before, it's so important to prime your body, so important to address the basic things that could change not only your life, but the IVF result, and in her case, a spontaneous pregnancy. So we started priming. She started doing human growth hormone, or Omnitrope. I usually recommend doing Monday through Friday, Saturday, Sunday off. That allows for sensitivity of the receptors and also for the vial to actually last the whole month. It's not cheap, as some of you know. Using the low-dose naltrexone, she cleaned her diet, eliminated grains, and started doing what I call a keto-ish diet. She started meditating. We are mind, body, spirit. So she started using yoga. She believes in something called praise moves, which is Christian yoga, if you want to call it that way, and really centering herself physically, emotionally, spiritually. She did all the supplements, the organic prenatal, the CoQ10, vitamin D, a food source, vitamin E, CBD oil, the gland therapy with the female endocrine pack, the whole 9 yards. And she was prepping to do another IVF. I believe her AMH was hovering in the 0.2, 0.3 range. And for those of you that know what I'm talking about, understand where she was. And we started doing high volume PRP in order to, again, nourish those ovaries, nourish that uterus and tubes, to try to cause some anti-aging and accelerated healing. We did that in January, in February and March with 3 PRPs, and she was about to start her IVF cycle when the COVID hit, and she was one of those cycles that actually got canceled. And so when she was able to return to us, we decided, you know what, let's do 1 or 2 more PRPs, and then we'll just jump into an IVF for June or July. So we ended up doing 5 high volume PRPs, and she did all of the supplements, the whole 9 yards, the diet, the nurturing mind, body, spirit, and she was waiting for her period to start her IVF. And 1 week went by, and after so many negative pregnancy tests, it did not even occur to her to do a pregnancy test until today, that she was 9 days late to see a very positive pregnancy test. Then she became pregnant spontaneous. Her beta HCG is 9,000, and we can't wait to do an ultrasound to see what's cooking in that womb. So I want to use her because it happens every day. It happens more than what we give credit for. Our bodies are designed to heal themselves if you allow them to. If you eliminate the toxins, if you give 7 to 9 hours of rest at night, sleep, if you eliminate the alcohol, if you eliminate the food that does not nourish, you allow that machine, like Dr. Kill says, to have the right fuel, you'll be surprised of all the things that could happen in your favor. And even if you need IVF because there's other factors affecting your journey, it will optimize the results. I'll see it both ways. Our nurse practitioner, Kim, I know that she has shared this multiple times, and I know she does not mind that I do this over and over again. Her AMH was 0.1, and she got pregnant on priming. She's about to have her baby boy this day. She's full term now. And with her, there's multiple patients with the same story, just because they've taken the time to honor their bodies, to honor their vessels, to honor their temples, okay? And allow that love, that self-love and care to sink in, just to end up with spontaneous pregnancies. We had another lady, 42 years old. We graduated her about 2-3 weeks ago, just from doing exactly what I'm describing. It seems very simple, but it's extremely powerful. And I don't want you to disregard those simple things of life that could mean so much. So I like when those miracles happen, and I like to share, because sharing is caring, and the last thing that should be lost is hope. Okay? So let's see, what do you have for me today? Hello to everybody. I'm very glad that you've joined me. When a new patient, can we make an appointment, and how? And yes, so of course, you can make an appointment. I will ask all of you to, be a little patient. All of the CNY clinics are a little overwhelmed, because I think it was like a dam where, with the COVID there was a stop, and then the flood came in, and I know that some of you have been frustrated because it's been a little bit more chaotic than usual. But Like I was saying, I always like to give you the numbers. The Atlanta office, it is 315-469-8700, and that is the main call number as well if you need to talk to somebody else, and the extension is 2274 and 2283. You're also welcome to reach out to one of our financial / administrative people, Jenny Ajay Perez. She is bilingual, CNY fertility.com. You're welcome to reach me directly, and Verdiales at cnyfertility.com, and I will forward the information so that we can accommodate you as soon as possible. Okay. All right, all right. Hello, hello, Michelle. So nice to see you. I hope you're feeling better. Luz, be patient. This is your time. This is your month, okay? I know that Luz is a little frustrated because her thyroid has been kind of going up and down, and it looks like there was like a lab error there, but it happens. Our hormones fluctuate. As long as they stay within a range, we are good. It's not set in stone. Let's see, what else? Do we simply request that Omnitrope? Yes, you can definitely request that Omnitrope is added to your protocol. There are different ways of using it. I like to prep with it, meaning I like to start the Omnitrope 1 to 3 months before stimulation, but you can add it to stimulation, and that also can help. Okay? Can this prep still help even with male factor? Absolutely. It takes 2 to make the thing go right, okay? It takes 5 things to make a baby: a good egg, a good sperm, a good uterus, tube, and a vessel. And that's what, I wanted to point out today. But we can prep males as well. We can do the same thing we're doing with the female, and more I'm incorporating that into my practice, including testicular PRP. So for those of you that have a male factor, I am doing a little bit of a pilot study on testicular PRP, and we already have our first pregnancy. It is a confounded, so this is a very interesting scenario. Very low ovarian reserve and a male factor, and she came to us with 3 failed IVFs at a different state. And even with us, it has been quite a journey. First IVF did not do so good, and then we ended up doing a luteal phase start and a higher dose, and Dr. Kills and we came up with a plan. And her husband had testicular PRP before going for retrieval. So, all these little things keep adding up. And she is pregnant, and we are crossing our fingers. She actually transferred 2 embryos, so we don't know quite yet what's in the oven. But yes, we can prep men as good as we can prep the girls. Okay? So I have a consult coming up. What should I be doing besides taking prenatals? First of all, keto diet, okay? Or as keto as you can get. Of course, with the diet, you have Dr. Kills on one extreme, 100% carnivore, and then we have the carboholics. We want to be close to Dr. Kills. I understand that keto can be rough for some of you, so start eliminating certain food groups like grains. Please, that has to go. Wheat, corn, soy, oats, rice. I'd rather you have potatoes than you have pasta. Same thing with the fruits. We need to, fruits are not our friends. They're full of sugar, and in this process they're inflammatory. Berries is an exception. You can do blueberries, strawberries. That's okay in small amounts. So clean the diet. Make sure you're doing vitamin D. Almost everybody's deficient in vitamin D. Make sure your prenatals are the right ones. So I have a few companies that I trust. One that's easily accessible is Garden of Life. You can get it in Amazon, and it's Garden of Life Raw, RAW prenatal. Make sure you get a good vitamin D with that. Start cleaning your diet. If you know you already have low reserve, you can add some CoQ10 and inositol as well as part of the prepping prior to that. You are welcome to call the Wellness Center. I put everybody on the female endocrine pack by standard process. The Wellness Center 770-266-0933. All right. So, alrighty, I hope that was helpful. So again, good prenatal. Garden of Life is one of the good prenatals. There's another one called Complete Research. There's anyway, those two I like. And then we have our special formula. Then CoQ10 inositol vitamin D, the female endocrine pack that you can get at 770-266-0933, diet and clean toxins. And what I was saying, meditation, it's not about, the high intensity stuff at this point, but you need to be able to have movement, yoga, tai chi, walking, biking, okay? Get that energy flowing in a smoother way. Okay. What type was adenomyosis and IVF? So for adenomyosis, I do have a few protocols that are very good for uterine support, including specific uterine supplements. Another thing that we can do for adenomyosis is do enzyme therapy. So, doing like high dose serapeptase with proteolytic enzymes. You can get that from a brand called Doctor's Best. That's the one that I recommend when I talk to you guys, and you can get that through Amazon. You want to take 120,000 units of serapeptase in the morning and in the evening on an empty stomach. An empty stomach means 1 hour before or 2 hours after a meal, and then you can add the proteolytic enzymes with that. That helps clear some of that scar tissue that the adenomyosis or endometriosis or scar tissue for whatever other reasons can help. And then we can definitely do PRP for, in conjunction. I like using multiple modalities, including fertility massage, especially break down, that scar tissue, stimulate that uterus to heal. Okay, so specific uterine supplements, and you're welcome to reach out to me directly. PRP, enzyme therapy, food source vitamin E like wheat germ oil, also very important for mucosa healing. Hi Stephanie, I hope you're good. I miss seeing you. I hope you're doing great these days. How many menstrual cycles in IVF from start to finish? Okay, so for your average person, we usually start with the first day of the period, and then it goes from the first, second, or third day of the period. That's usually the baseline and the start to 2.5 weeks or so, but if you're going to do it all back to back to back until there's an embryo transfer. So the first part of the IVF is 10 to 12 days of injections to recruit a lot of eggs. So we're kind of mimicking a normal cycle, except it's hyperovulation. So we get it early on. That's why we want those ovaries to be kind of quiet, no lead follicles. And then we recruit a bunch of eggs, and then retrieval would be ovulation, and that is actually day 13, 14 of the cycle. And usually in nature, implantation happens about 5 days after ovulation. So that's kind of where we're aiming to put an embryo or two back in, depending on your particular scenario. Can I do a baseline and meds with no menstrual cycle? Yes, you can. We actually do that for certain people as well. We would have to check on your particular situation. the reason that you don't have a period, is it PCOS or what's going on in your body, we can either provoke a period or put you on estrogen priming and then jump into a cycle if the lining permits, but we would have to kind of evaluate your scenario. 5 weeks and 3 days. Amen, Elisa. Great. That is wonderful news. Congratulations. 5 weeks and 3 days gestational sac is normal. So I know that you've been struggling with this for a little bit. So cross your fingers. I'm very glad that we see something pop. Alrighty, so thoughts on Neupogen versus Neupogen wash. So Neupogen is an immune medication. It's an immune booster, and it works somewhat like the PRP. It stimulates the lining to get thicker, okay? It has growth factors in it. It stimulates the lining to go thicker. Okay. What is my next step after having polyps removed? Jump on it. There's no real downtime. You can jump on your IVF with your next period. Priming after FET versus transfer meds. What do you start before? You can definitely do priming for FET. I've done that before, especially if there's any concerns about implantation or there has been failures in the past, either by recurrent miscarriages or failed FETs or transfers. And then, you know, I say we're doing uterine priming. So just like the lady with adenomyosis, we've kind of focused on getting rid of scar, potential infection. So I like doing an endoscratch, PRP, antibiotics, enzymes, you know, vitamin C, A, E, food-based, okay? I keep pointing that everything that I will recommend when I talk to you guys is very specific because of that. Just because the vitamin complexes come in their natural form and they're utilized a lot better by the body instead of the synthetic vitamin that you get in the supermarket or the regular pharmacy that is not exactly the right composition. But going back to that, so if you've had that scenario, recurrent miscarriages, failed FETs, then yes, we should do priming for that implantation situation, including potentially doing an ERA, making sure that the lining is matching the embryo. I know ERAs are not cheap and they're a little cumbersome, but sometimes it is worth trying. What can I do naturally to lengthen my cycle? PCOS. Okay. So no, IVF is not your only choice. Sometimes just using letrozole will lengthen the cycle. And then you should probably have a monitored cycle where we can trigger and then give you progesterone. Either you do time intercourse or IUI. But I think that with you, Jennifer, the key is going to be a monitor cycle that we can follow that follicle, trigger, and then support it with progesterone. So it's IVF, as long as your tubes are good, it's not, and the semen is good, of course, it's not your only choice. What is exactly the endocrine pack? I like a company that is called Standard Process. It's food-based, organic, and it's a little pack, and it supports the endocrine system from the hypothalamus, pituitary, thyroid, ovaries, adrenals. Okay, so it has I call them the cow pills. So it has little bits of those organs to support them, to help them work better. It has currant seed oil. It has a food concentrate, and it has the omega-3, and it comes in a little pack, so it's very easy to carry around and take. Okay. Okay, what happened when your frozen has failed? Was the next step if there has not been any reasons to suspect an issue, okay, like you've never been pregnant, this is your first transfer, you can tweak it a little bit. You know, you can add some Paragraph, you can add some PRP. If you want to really get aggressive and go into like what I described, you can do a uterine priming, you can do ERA, you can do endoscratch, and you can get really aggressive with the protocol. But the most important thing is to try again, because you know, as much as IVF is the best technology we have, it's only 50% chance of success. So it's still a trial, you know, it's still a marathon and not a sprint race. Okay? Alrighty. I am in early menopause. Would you consider PRP before donor eggs? So it depends on your numbers, your age. I'm a believer in miracles. I think the last word comes from heaven. So, and I think that in your heart, you have to be ready for the donor eggs. Donor eggs will always be a choice. They're going to be there. I mean, the donor is 30, 31, and those eggs will be that age. But you have to be ready in your heart. That's number one. Two, it depends on how into menopause are you. Although I do have right now 2 ladies that they're on this journey of, you know, pushing that envelopes with like no periods, menopausal levels, an AMH of 0.08, and they're going for it. They're not ready to make that transition to donor eggs. So it really depends on your age, your numbers, and what journey are you willing to walk. If I'm like right there, let's say I'll use some numbers. Let's say my AMH is 0.1, I'm 40, and my FSH is 20. Absolutely, I would do the whole priming, go crazy with it, PRP, high volume if possible, 3 months in a row, the diet, the Omnitrope, the low-dose naltrexone, the gland therapy, the CoQ10, the prenatal, name it. I would try that first. Hey! Oh my God, Heather, may you be blessed. I had a wonderful gift this week. I wish I had it with me to share it, but I'll share it with you next time. One of my patients brought a soap with a sperm, no, 2 sperms and an egg. It was really, really cool. So maybe we should have them all over the CNY clinics. Thank you, Heather. That you've made my week. Okay, I will be in Syracuse for my retrieval. All right, so PRP before transfer, I like to do that first. So somewhere in that week before, so 7 to 5 days before transfer, I would do the PRP to kind of give it some time for it to get to work. And the ACG wash, I like doing it the day before or the day of transfer. So the difference between the high volume PRP and the regular ovarian PRP is that it is the ovarian PRP, and that's the one that was first described, is injected into the ovary. So, you know, there's an argument whether it's a little more potent or not more potent. However, it is more invasive and requires anesthesia. The high volume PRP, as long as we have open tubes, or at least one open tube, it's like a saline ultrasound. So we're bathing your female organs, including the ovaries. And because I've done it under ultrasound guidance many, many times, I can see that it really, you know, bathes the ovaries, since the fimbria, or the end of the tube, is around it. And it works really good. It's accumulative. So that's why I do recommend 3 cycles in that priming process. I am 7 weeks pregnant now, but with a diagnosis of aggressive breast cancer. Can you recommend any supplements to take, say, for a baby? Absolutely, Mary. I would love to put my hands on you and do something called kinesiology and muscle testing, because we can definitely work through this and you can win this battle. I can almost guarantee it. My favorite supplement, and that is very dear to my heart, is Ganoderma or reishi mushroom. It is an immunomodulator and it boosts the immune system in favor of you. You also want to have your vitamin D above 50. Extremely important. Vitamin D is a natural anti-cancer. It's crucial for the immune system. And let's see, what else can we do? Turmeric. Okay, turmeric is safe, and high dose turmeric, high quality. And that, if you message me on my personal Facebook, I will go over this a little bit more in detail. Detoxing pregnant, not such a good idea. But there are things that can be done, including something called black salt that is just amazing. I had the honor of meeting a breast cancer survivor who took, pretty much healed herself naturally. Is Dr. Veronique. She's French Canadian, and it's a blue book. I am in the middle of a move. As you can see, all my books are packed, otherwise I would have shown you. It's Dr. Veronique Denacier, something like that, with a D, and it's Treat Breast Cancer Naturally. Please get it in Amazon. It's a purple book with a butterfly, and there's a lot of information that will be completely safe in pregnancy with that diagnosis. And again, please message me. I don't know where you live, but I could try to help you with that. Cancer is very dear to my heart. I am a widow, and my husband passed of rectal cancer. So it's it's personal. So I'm sorry you're having to do this at this point, that, it's kind of celebration and all these angst at the same time. But you're not alone, and you'll be able to battle this. You're not alone. Okay. All right, thyroid. I have another person with a thyroid frustration, like loose. So the thyroid fluctuates. The thyroid is very much affected by all these drugs we're using, iodine deficiency, blah, blah, blah. If they corrected you a little too fast, they probably just push you over the edge, and you just need to back off. Okay, and yes, the racing heart, definitely too much thyroid medicine for you. Can I do an ERA test between the retrievals? Yes. Now the ERA test has to be a monitor, so it's a mock FET transfer. So you have to do the monitoring, you have to do all the medications just like you're going to transfer, and then you do a day 5, to be exact, 121-hour biopsy. Am I familiar with Trintelix? I would have to look at the generic for it. Lamictal, not so good. The idea is that you are in the least amount of psych meds as possible as you go through this journey. All right. All right, so our time is kind of up for tonight. If there's anything that you really want to talk to me, you can message me in my Facebook, Maribel Verdiales, with V as in Victory or vagina, whichever way you want to see it. And I will get back to you as fast as I can. And if you want to, do an appointment, give me your basic information so I can give it to the front desk and we can get you in. We do this out of love for you. It is a great gift and honor to serve those of you that cross my path, and for those that will be coming, may you be blessed. All right, so I shall see you next Tuesday, 9 p.m. We're back on track. It might be a little chaotic in my life since I'm moving, but I'll be here. Okay, bye-bye.